It is quite advanced in the last 20 years, I would say. It seems like a dramatic change has occurred where we really can get people pregnant and we can manipulate biology in a way that's, I think, a surprise to most people. I've started counseling young people in my office, not telling them to freeze eggs, but the lifestyle we have these days, everything is delayed. People are in a delayed maturation. Relationships start later. People make their money. It takes longer to establish themselves. Of course, women in careers, it takes longer for them to get to that point where they're ready. So I try to bring it up to younger couples because I think so many people, they just assume there's no problems. So I do a lot of metabolic work and what I call lifestyle medicine, right? And in that world, you just see so many people with metabolic disease, even if they're per se skinny, because they could be very unhealthy inside. Yeah, and then you see this really bizarre thing happening to men with low testosterone levels. Every guy I'm testing has motility issues with their sperm. You know, there's starting to be some signs, like recent study looking at sperm, 100% of the sperm had plastic in the sperm. This just came out like a month ago.
I mean, there are so many different challenges that, reproductive cells will face. And certainly, we are swimming in a soup of, and not just chemicals, but stress and radiation and like infection, even food. These days, ultra-processed foods is a major source of toxic exposure that will negatively impact fertility. So ultimately, it starts to be something that we need to take into account at such a way, as opposed to just thinking that fertility and reproduction is solely about getting the egg, getting the sperm, and there you have a baby. Because that's the piece that a lot of people miss. That's the piece that a lot of people get wrong. You did accurately say that yes, we do have incredible development of technology, and what's possible today wasn't possible in many ways in 20, 30, 40, certainly not 50 years ago. But the problem remains that approximately 70% of IVF cycles still fail, right? And so it's not a, surefire way of overcoming infertility and recurrent miscarriage. And the failure rate of these treatments is high. And so looking at every possible aspect that is going on in terms of a person's lifestyle, exposure, I call that the foundation upon which you can overlay effective treatment. Lifestyle medicine is wonderful and it's a wonderful foundation. But if we stop there as well, it's not going to be enough, because what happens is that when it comes to fertility, we really have such a finite amount of time into which we can get an effect. So if we were to optimize only lifestyle and the things that you can do in terms of that, but then kind of neglect and stop pushing through all of the other areas that are available to us, then it becomes one of those challenging situations. And look, by all means, there are values and preference choices that patients will make. Sometimes I get patients who come to me and they're like, look, I will only ever want to try and conceive naturally with my own eggs, with my husband's own sperm. Therefore, anything beyond that is not something that I would do. And sometimes I have, even within that, preferences within preferences. I will take this supplement, but I will not take that one. And I will not take this medication that can help me. It's one of those things. As a clinician, I think that our job is to inform, is to bring the evidence base, look at the patterns that we know are going to contribute to a positive outcome. But at the end of the day, I think that there is a lot to be said for how the patient's journey is going to unfold based on how they wish to have this happen. And I'll give you an example. I had a lady a couple of weeks ago who was referred to have a conversation with me, and came to me and she basically said, I don't know what to do. I've just gotten this result and I think that I have low ovarian reserve. And so she was very distressed, as you can imagine, for a woman of 30 years of age to find out such challenging and confronting news, And sometimes people read results incorrectly. So I said, look, let me just have a look at the results, and I'll look at the result. And indeed, not only did she have low ovarian reserve, she was showing signs of premature ovarian failure. And that basically meant that, well, within a couple of years, she probably would lose the opportunity to have a baby with her own eggs altogether.